Good morning and welcome to today's video. Yesterday we talked about degenerative joint disease, and I mentioned how that was one of the most common questions that were asked in my office. Another really common situation that comes up in my office, aside from the vertebral subluxation, again, and if you want to know more about that and how it affects your body, watch the 4-part series earlier in this blog about how chiropractic works, and then you can watch the degenerative joint disease video, which I think is titled Arthritis, and that'll help you understand the effects of long-term subluxation. But one of the things that a lot of us experience is referral pain from what's called a trigger point. And a lot of times if you come in here and I myself am working on you, or if Angela or another one of our massage therapists is working on you, and we hit those points in your muscles that are really painful, and we stay on that point and we push it, I don't know if we necessarily always explain to you why we're doing that. So I want to explain to you what a trigger point is and what the effect of it can be and why we do what we do. What a trigger point is, it's a spot in the belly of a muscle. Now the muscle is basically contains two parts. There's the belly, which is the thickest part of the muscle, and then there's the tendon, which is the edge of the muscle on either side that attaches to the bone. Okay, so the tendon attaches to the bone and it becomes a narrow fibrous strip that attaches to the bone. And then when you get into the actual contractile part of the muscle, or the part that contracts the muscle, that's called the belly. Inside that belly there are muscle fibers, and what happens is sometimes we'll have a spasm, for example, in a muscle. And it may not be the kind of spasm like a Charlie horse that you get when you're sleeping in your calf or something like that, but it's a chronic spasm that can cause, tension and aches and pains. Well, if that spasm stays there for too long, what happens is the nociceptors. Now, a nociceptor is a pain fiber. It's a receptor in the muscle that feels pain. Those nociceptors can become more sensitive to pain sensations. And when that happens, if it's a trigger point, what it does is it causes a referral pattern. So for example, one of the most common things that I see in my office, there are two conditions. Number one is shoulder pain, pain in this area. And a lot of times people think, well, gosh, man, my shoulder's killing me and the pain's coming from here. Well, the fact of the matter is, if you get in here and start messing with these muscles, you'll find that there's not a whole lot of tenderness to the touch. It's coming from the back. And back in the back, there's a muscle called the infraspinatus, and there's the teres major, teres minor. You've got your rhomboid muscles, your middle trap muscles. All these different muscles have referrals to different places. And if we get in there when we're working on you and we find a spot that's tender, and when we push on it, it refers to that shoulder, then we know that's a trigger point that could be causing the problem. And I know this personally because I have a chronic trigger point that refers to my shoulder. I'm not in chronic pain, but occasionally if I let it go too long, or if I overdo it or something like that, I'll start having some shoulder pain, and I know exactly where to go and work those trigger points. So what you do with that trigger point is, the goal is to find these spots on your body that refer pain to another spot. Once you find that, you want to hold that spot. So you push in on it until you feel that referral pain as much as you can tolerate, and you hold that spot for 10 seconds, and then you release. And then you hold that spot again for 10 seconds, and then you release. And then you hold it again for 10 more seconds, and then you release. As long as you're still feeling the referral pain, you're going to do it all 3 sets of 10 seconds. If at any point in those sets you notice that referral pain leaving, then you can stop doing the pushing, because you've actually caused that trigger point to release for the time. Now, how do you get into that trigger point, especially if it's on your back? Well, one of the things that I recommend to patients is you take a tennis ball and you put it inside of a sock. You throw that sock over your shoulder so the tennis ball's on the back, and you lean up against the wall and you move that tennis ball around until you find those spots that refer. Okay? And you do the technique that I just explained. Now, what are the most common trigger points that I see? Well, the first one is that shoulder pain. And again, you're going to find that in the middle of your back, either on the inside of your scapula, which is your shoulder blade, or on the outside of the scapula. And you just look around and try to find those spots. If you can't find it, come on down to the office. I'll be glad to help you find them, and I'll show you how to work the trigger points, and we can get that taken care of. Another very common one is at the base of the skull. If you have headaches, a lot of times you can take your thumb, push into that base of the skull, and you'll feel that referral pain coming around and mimicking your headache. These you have to be careful with because you can work that trigger point and that will probably give you some relief, but it's going to be short term, especially if you have the top bone in your neck is out of place. So if you're having chronic headaches, come down and see us. We'll be glad to adjust you and see if those trigger points are a contributing factor, and we'll try to work all that out. And another common trigger point is down in the low back and down in the actual butt muscle. And those trigger points can cause pain to refer into the hip and of course down the leg. It's a very common cause of sciatica. So anyway, these trigger points are very, very important. The adjustments will help the trigger point to get relief, but we can actually get you better relief quicker if we can treat the trigger point and the subluxation. So I hope this helps. I hope it explains it a little bit. If it's confusing or if I didn't explain it well enough, please leave me a comment or send me an email at drpricedc@aol.com, and I'll be glad to try to clarify a little bit further. Give us a call at the office, 862-2224, if we can do anything for you. And you guys have a great day. We'll see you tomorrow. Bye-bye.